Medical Monday is sponsored by University of Maryland Capital Region Health.
We have a very special guest with us right now. We're with Dr. Nanavaty. It's great to see you, and we are at a very special place. Tell us where we are right now.
So we are at University of Maryland Capital Region Medical Center, a brand new facility here in Prince George's County of Maryland.
And my first visit, if you haven't, you probably have driven by the construction and seen it, but to come inside, it's really an incredible facility. We're going to talk about some really important stuff today, and that's lung cancer screening, and the things that can happen if you catch lung cancer early. But let's start with what is a lung cancer screening and what does that look like?
So lung cancer screening is looking for lung cancer before you have symptoms. Once you have symptoms of a disease, then you are trying to make a diagnosis, versus screening happens before you have any symptoms of a particular disease. And in lung cancer, it is important to screen because if you wait for lung cancer symptoms to come, you have waited too long, and then your outcome may not be the best possible for you.
Well, there are some positive outcomes, so let's talk about who should be getting screened and how that screening process works.
So patients who have smoked for 20 pack years, that is 1 pack of cigarettes a day for 20 years or more in their life, who are between the age of 50 and 80 years, and if you have quit smoking, you are within 15 years of quitting smoking. If you do not have any symptoms suggestive of lung cancer, then you should be screened once a year, every year, starting today.
Kind of scary to talk about it, but what if a test does come back positive? We shouldn't be scared.
You should not be scared. Fortunately, a lot of lung cancer screening that happens with the help of a low-dose CT scan. If the CT scan is abnormal, you'll be seen by a pulmonologist like me. We typically work with a multidisciplinary team, and the team determines the best possible outcome for you, whether to approach with a biopsy, approach with a surgery, or wait and watch approach.
What is the best way to reduce our risks of lung cancer? This is something that we all can follow.
Right. So currently, the most common cause that is preventable in lung cancer is smoking. So smoking cessation is the best thing you can do to reduce your risk of developing lung cancer. And that is why, even after years of smoking, within 15 years, your risk of lung cancer goes down to that of general population. So stopping smoking is the best thing you can do.
Very important. So we're going to put a QR code on the screen, and there's also a website. People can scan that QR code and they'll receive a survey right on their phone. It's super easy. You open up the camera on your phone, scan the QR code. What's that survey going to do for people at home right now?
So the survey will take you and help you figure out if you are the one who needs lung cancer screening. And at that point, you go to your primary care doctor, or the survey will lead to one of us. We can help you, explain you what the procedure is, and then most insurances cover this lung cancer screening, which is vital and most underutilized screening tool available for cancer screening.
Well, and I think what we're learning here, and that's why it really is important to just get that QR code right now, open the survey, take the quick survey, or go to the website, and if we can prevent the lung cancer and catch it early before there are symptoms, there is so much people can do, and it's curable, you said.
Right. So if the lung cancer is caught in its first stages, when it is just localized to that area, that lung cancer nodule can be resected, and you would be cured of lung cancer. That is the only early stage lung cancer is the only curable disease. So better to catch it early and help yourself.
And it all starts with that survey right now. Follow the website or the QR code on your screen. Doctor, we learned so much today. Thank you so much.
Thank you very much. It's my pleasure.